Good evening, and thank you for joining. For those of you who do not know me and I have not met, my name is Stephen DelRossi. I currently serve as the interim CEO at the hospital, and I am the permanent CFO. I've been here at the district now for 14 months. I've enjoyed my time here and will continue to enjoy my time here. By way of introductions, I'm going to introduce the rest of the executive staff, and then we'll start discussions on the hospital. Serving as the Chief Operating Officer and the Chief Nursing Officer is Alan Partridge. Serving as the Chief Medical Officer is Dr. Adam Hawkins, and serving as the Chief HR Officer is Allison Murray. With that said, I'd like to address the state of the hospital, where we are now, the changes that have been implemented, and where we think we are headed, and why we're heading that direction. First of all, the hospital, as many of you know, has had trying financial concerns over the last few years. Over the last, for fiscal year 22 and fiscal year 23, the hospital has lost in net change of financial position $31 million. And if we were to look at operational income, which is what we would look at if we were a private hospital, we far exceed that $31 million. To correct this, the hospital created a TAG group, which stands for Turnaround Action Group, that started services and recommendations in early January. We have worked through some 150 recommendations. We have vetted each recommendation, and we have made changes based on those recommendations. We anticipate more changes to come. We have some plans for the hospital that will further the operations and shore us up on a firm financial footing. With that said, that is not a magic bullet. It does not happen overnight. It has taken us a year to get in better financial position than we were this time last year. And I anticipate it will take between 2 and 3 more years to have consistent, profitable operations. To do that, we use a strategic plan. Our strategic plan expires on June 30th of 2024. The board and the executive team are working on a new strategic plan. It will fall into effect on July 1st, 2025, and it will be a 3-year plan. The plans are usually 3 years in length. You look at a 1-year, a 3-year, a 5-year, and a 10-year. So we are concentrating on the 3-year plan to get us to financial stability, and then we will circle back in 3 years and write a 1, 3, and 5-year plan. Moving on, I think what most people are concerned about is the fiscal viability of the hospital and where we stand looking into the future. If we were to look back at this time last year, the hospital had produced in revenues $48.7 million gross revenues. It's important to understand gross. In 2024, for the same time period, we've produced $55.7 million in gross revenues. We are leading last year, and we are excited about that. That is not something that came easily. It's come with a lot of hard work by the staff at the hospital, with over 400 employees dedicating themselves selfishly to improving the operations. With that, we also want to look at where we are in terms of expenses, because the community has talked about the raises we have given Understand we give raises to be competitive, not only in Bishop and not only in California, but nationally. We have to compete with nursing, with radiology, with all of the other services we provide on a national basis. And we try to pull people from all parts of the country to give different experiences to better improve the operations of the hospital. Now, these are not positions that are easily recruited from the Bishop area, as these are licensed positions and require a degree of education, and some of them advanced educations. In terms of our expenses over this time last year, sorry, give me just a second. Our total expenses have increased $153,000 from this time last year. So you can see that we've given raises and we've made changes in operations and marginally increased our expenses while increasing our gross revenue some $7 million. This month, ending September 30th, the hospital has a positive net change in financial position, which again, most companies call that net revenue. We are at plus $864,000. We had budgeted a loss for this fiscal year, drawing down on reserves of $13.7 million. We are at this point about $5.5 million ahead of our budget. So that's all good news. The next thing I'd like to discuss is our audit, where we were last year and where we anticipate being this year. Last year's audit was done by Bailey, a national auditing firm, CPA firm. And they found 4 findings which were related to various controls, balance sheets, pension administration, pension accounting, and contractual allowances. All of those have been resolved with the exception of a few balance sheets still being out of balance. Understand these accounts that are still out of balance have up to 15,000 entries a month, and they were unreconciled for the last 3 years as we continue to work on those. We anticipate that we will have a clean audit, but we do anticipate at least one finding, and that's on fixed asset accounting. It's not in terms of value, it is in terms of maintaining the paperwork with the fixed assets. As a matter of exercise, we look, the executive team, the management, and the employees, we look at every opportunity for saving money for the district. In particular, we look at contracts, which we've saved at least $600,000 over a 5-year period. $300,000 in a 1-year period. And we, as an exercise, looked at the Birch Street building and should we keep the building or should we sell the building? That building originally had a cost to us at $799,000. We've had a realtor company value the property for us, and they valued it at current at $899,000. It seems like it would make sense to sell that property and take $100,000 profit, but upon closer examination, you know that we will have realtor fees, and we would have to find space to store certain documents that have to be access controlled and climate controlled. So selling the building is really not a viable option for us. Many of you have heard, I believe, in the community that we engaged a company called RSM. RSM is the 5th largest CPA firm in the country. They have technical expertise on our EHR, our electronic health record. We have spent the last 7 months working with them, and we will continue to work with them on a per-hour basis moving forward in resolving issues within Cerner, which is our EHR. We had over 50 technical corrections that had to be made to be able to operate our software properly. So that's kind of where we're at as a hospital. Let's talk about moving forward. We have a budget, as I said, of a loss of $13.7 million, but also, as I said, we are ahead of that budget by $5.5 million. The goal is to stay on track with that, and that would put us at about a $4 million loss, or rather change in financial position. We think that can be overcome in the next 2 years, but that certainly gives us plenty of time, plenty of opportunity to make more corrections and add additional services. I want to emphasize the fact that we are adding services to take care of the patients and to give this community what we think is appropriate care for the community. This is very important to the employees, to the executives, to the managers, and most importantly, to the community, as it will cut down traveling out of the area for some of these services that we think we can provide at a reasonable cost with a low market input cost. I've received some questions and comments from the community, and I am going to read the questions and comments and then give you my answer on those. First, it says, can I address the issue regarding Blue Shield? Blue Shield has sent out, Blue Shield of Texas has sent out letters in Mammoth and in Bishop, and I suppose Big Pine, I'm not sure of that one yet, noting that we are not in network with them. That is not correct. We are in network with them. We are working with them to resolve the issue and to send retractions. And we expect that to be done here within the next week. It was brought to our attention from a community member, which I thank that community member. And as things roll out and you find things in the community that affect the hospital in one way or the other, positive or negative, we ask that you bring those things to our attention. It's one of those cases as we don't know what we don't know. Blue Cross and Blue Shield and Anthem, which is a subsidy of Blue Shield, continue to reimburse us at contracted rates. So I do not anticipate any problems with that. The next question, it says, I am a former RN employee. I am concerned about the hospital pension fund and would like information on the status of the fund. I know there were financial issues with the hospital, and I am putting in for my retirement soon. I have concerns if I take a monthly amount. And then it's broken into 5 segments. The first segment says, are there funds to keep everyone paid for the next 20 years? We have worked with our actuaries and the fund managers to have a 20-year vesting strategy, and we are ahead of that vesting strategy. They have given us a number. Last year, that number was $413,000 to be funded over 20 years. We were able to invest more than the $413,000. We invested $500,000 a month, which brought us to 20% funded. It's important to understand also that lowered our funding rate to $391,000 over 19 years. And we continue to invest more into the fund than is actually required. The reason we do that is because something called the fair, cash today is better than cash tomorrow. In other words, the more cash we have today to invest, the more time it has to grow over the years, which protects everyone's interest. We wind up spending less money and the fund gets completely funded. Part B says, how much is currently in the fund? As of the last actuarial period, which ended 6/30/23, it was 20% funded. And understand that the actuary does the analysis only one time a year. So the next report will be in July of the coming year. The next question says, what is the total in and out monthly amount? That is two questions. The first question is, how much do we fund? We fund right now $413,000 a month versus the $390,000 that we were told to fund. Now, how much comes out? That is a different question. The custodian of the account takes, whenever you retire, a person retires, they create a sum of money based on whatever the algorithm is, the time and service, maximum salary, etc. And they come up with a value on that given day. And that two things can happen at that point. The fund managers can buy an annuity for you, which means it's your money and no one can take it and you get monthly payouts, or you can take a one-time cash out the door and you wind up in the long run with less money. And you have a huge tax burden in the year that you took the money. And the next question, what is the status of the deficit? Once again, we are about $5.5 million ahead of our projected $13.7 million deficit. That comes from the hard work of the 400 plus employees, taken with the management and the executive staff that has been working tirelessly to make a difference. It's come with very hard decisions, very uncomfortable decisions. We know it's affected the community. We know it's affected certain individuals. And I wish it had not come to this, but the reality is we have to make sure we have a hospital that is sustainable for not just a year or two or five. I want it sustainable for the next 50 years. My children are looking to move to this community also, so certainly I want a community hospital for them. The next question is, what is the likelihood of NIH being bought by a large healthcare system? Thank you for the question, but that is not a consideration. We are a hospital district that is operated by a management staff that answers to the CEO, that answers to a publicly elected board of directors. I take my direction from the board. We work on, the executives and I and the board work on strategic plans, and those plans will bring us a hospital that will be here into the foreseeable future. I also want to note that in doing so, this hospital, the employees, the managers, and the executives have worked extremely hard in responding to community needs and bringing in services that will not greatly impact the cost to the hospital, but we'll bring in services that are much needed in this community. Some of the services you've already had in this community and they left, and we brought them back. In particular, we brought back cardiology. We've brought in another general surgeon. We brought back a urologist, and we will continue to evaluate the services that we have. We will continue to look at what is in our community needs assessment, and we will respond accordingly. And I'm sorry, the other one that I want to mention is that we brought back mental health. Sorry. And then there is the question that says, when will there be an in-person town hall with more than 5 days notice? Ad was not easily found in Inyo Register, and 50% of my neighbors had no idea there was a town hall. This rollout was very inept. Only a third of residents subscribe to the register. In addition, many people do not have computers or internet access. I want to clear a few things up. First of all, we advertised in the paper 4 weeks in a row. We placed ads on the radio. We discussed this at 2 board meetings. We placed it on our website. I discussed it at the city council. I discussed it at Inyo Associates. I discussed it with people with whom I talked at the cancer walk. So it's been out in the community. Maybe not everyone's received that, and I apologize for that. The best place to get information on how the district is operating and to make comments to the board about what you would like to see or what you think is wrong is by attending either in person or virtually our town hall, I'm sorry, our board of directors meeting. That meeting starts at 5:30 every third Wednesday of the month. So there's 12 meetings in a year, and if needed, we will call emergency meetings. So those are the updates I wanted to give you. Now, there are several ways of talking with me or the other executives. I maintain an open door policy. If you need to see me, then you can reach my assistant, Corey Stearns, and you can reach her by email at Corey, CORI.Stearns, STEARNS, at NIH.org. She will call you and ask the topic, and then she will find the appropriate amount of time to allow you to discuss with me any concerns you have. Now, this is not something new that I've been doing. I've been doing it pretty much my entire career at every level. And I've had several members of the community already reach out to me, come in and visit with me. And sometimes it's just a visit, sometimes it's a serious issue, and they are all handled accordingly and to the appropriate level. I also want to say that from time to time, there are negative issues that run through the community. And what I want to remind everyone is, yes, we're medical professionals. Yes, we have a zero tolerance to making errors. But we understand that we are human. Sometimes we make an error and we correct that error. And if that's not your perception or that's not happening for you, once again, you can reach out to me. You can reach out to our corporate compliance office, or you can reach out to any of the executives who I named at the beginning of the meeting. I encourage everyone to send questions. We will have another discussion in 3 months. Our marketing director will come up with a date. It will be at the beginning of a month, and we will reconvene at that time. At this time, that's all of the prepared statements I have. Once again, if you have particular questions, please reach out. Otherwise, have a good night, and thank you very much.